Hi, my name is David Clements. I'm a orthopedic surgeon and I treat patients with scoliosis in Philadelphia and southern New Jersey. Scoliosis actually doesn't really have any symptoms, and that's why some children don't have it discovered until they see their doctor. One of the most common reasons that it is discovered is if you have back pain. You go to your doctor with back pain, they're going to take an x-ray and they might find scoliosis then. It's confusing, but actually scoliosis doesn't cause back pain. Back pain was the reason that they found your scoliosis. Scoliosis by itself doesn't hurt, and the vast majority of kids who have scoliosis have no pain or any other symptom of it at all. So the first way that we diagnose it is by examination. So what we're going to do is we're going to look at your back. Usually we'll have you stand so that your parents and us can both see your back. And we'll look at it, and there are certain things we look for. Is one shoulder a little higher than the other? Do one of your shoulder blades stick out a little bit? Maybe your waist is a little different and your hip sticks out a little bit on one side. After we've looked at you and had you bend forward so we can look at your chest and look at your back, and we're suspicious enough, then we'll get an x-ray. When we get an x-ray, we're already suspicious you might have scoliosis, and the scoliosis then tells us how severe the scoliosis is and helps us decide what's the best thing to do to treat it. While you're having an x-ray, you don't feel anything. It doesn't hurt, and it doesn't harm you immediately while you're taking the x-ray. And most x-rays, as long as you space them out and don't get them frequently, are not going to cause any permanent long-term harm. X-rays can cause harm, though, if you have too many x-rays done in too short a period of time. And your doctor will make sure that you don't have more x-rays than you need to take care of your problem. There are different types of curves in scoliosis. Usually the biggest curve is what's called a structural curve. That means that it's a stiff curve and it's not going to straighten itself out. It's the real curve that's driving the scoliosis. A functional curve is one that happens because your body has to adjust to the fact that you have this structural curve. If you didn't have a functional curve, the structural curve might make you lean to one side permanently or not be able to stand up straight. So scoliosis typically happens whenever you're a teenager, meaning about 10 years old, 11 years old. So starting to screen then is probably prudent because it's very rare for it to come on before then. It's also very easy to get it done at your pediatrician's office when you go for your yearly checkup. And most pediatricians will start to check you when you become a teenager and then check you throughout the years whenever you're growing to be sure that you don't develop scoliosis, or if you do, that you get to have it treated appropriately. So the big concern we have with scoliosis is it going to get worse? And we want to make sure that if scoliosis is discovered, that it doesn't get any worse so that you can have a normal life. If you have a scoliosis that doesn't require anything drastic like surgery, you can have a normal life, you can have a normal teenage years, you might have to wear a brace, but you can do all the things you want to do as a kid. Our main goal with scoliosis treatment is to keep it from getting worse so that it doesn't affect you for the rest of your life. So several things happen. The first thing that's going to happen is your body's going to assume an abnormal shape, meaning instead of standing up straight, it's possible as your scoliosis gets worse that your shoulders might change, your trunk and torso might change shape, and it may turn into a shape that's not very pleasing. The next thing is, if your spine continues to bend and your scoliosis continues to bend and get worse, as you get older, it can cause more problems with your lower back, with your breathing, and it can make it difficult for you to do the normal activities of daily life. So most scoliosis that we see happens in the teenage years. It usually starts around 10 or 11 years old and progresses during that time. There are a small group of people who have it develop earlier, before the age of 10. usually by age of 3 and on. This is a small group of patients with scoliosis, not seen very often, and it's called early onset because it's happening before we would normally expect it to occur.